Hey, this is Monse, one of the interpreters. If you all want to get us assigned to the channels, we are ready for that. And you can do interpreter Monse and interpreter Ingrid. Let me know if you need any support on assigning us.
Welcome to the third in our webinar series, Protecting the Next Generation of North Carolinians. Today's focus is youth substance use. We have partnered with the North Carolina Department of Health and Human Services for today's discussion. We are glad you're here. Before getting started, I'd like to give our interpreters, Monse and Ingrid, a few minutes to provide instructions on how to use the interpretation feature.
Hello, everyone. Hola a todos. This is Ingrid, and I am here with my co-interpreter, Monse. We work with Sensontle Language Justice Co-op based in Asheville, North Carolina. Hola a todos, mi nombre es Ingrid y estoy aquí con mi co-intérprete Monse. Somos intérpretes para Sensontle Cooperativa de Justicia del Lenguaje basado en Asheville, North Carolina. Everyone who is not bilingual in Spanish and English will select an interpretation channel today. Todo el mundo que no sea bilingüe en inglés y español van a seleccionar un canal de interpretación hoy. To hear interpretation from Spanish into English, please click on the globe on the bottom right, then click English to hear interpretation. If you're joining via the Zoom app on your smartphone, click on the three dots, Language Interpretation, English, and Done. Para escuchar la interpretación del inglés al español, por favor hacer clic en el globo que aparece a mano derecha, luego hagan clic en español para escuchar la interpretación. Si están llamando desde la aplicación de Zoom en el celular, haga clic en los tres puntos, luego interpretación de idiomas, español y finalizado. Please remember to speak at a moderate pace since we will be interpreting live. Por favor, recuerden hablar a un ritmo moderado ya que vamos a estar interpretando en vivo. Thank you for creating this multilingual space and please let us know if you need any support. Gracias por crear este espacio multilingüe y por favor háganos saber si necesitan cualquier apoyo. Have a great meeting. Tengan una buena reunión.
Thank you. A few housekeeping notes before we begin. This webinar is available on both Zoom and YouTube. The YouTube live stream can be accessed at www.youtube.com/@NCAGO/streams. And if we approach 500 attendees and you are not going to be utilizing the live Spanish interpretation, please consider moving to that YouTube channel because the interpretation is available only on Zoom. Our transcription, the link to the YouTube channel is also available on the registration page. Transcription is available on Zoom and can be turned on via the button at the bottom of the screen. We have a limited amount of time today, but we'll try to address questions that are not covered in the webinar in a follow-up email. On Zoom, please submit questions using the Q&A feature. And if you're joining on YouTube, please email questions to outreach@ncdoj.gov. In addition to any follow-up questions, we will also share a recording of the webinar after the presentation. We are honored and excited to have a great group of presenters today, North Carolinians who are passionate about educating the public on youth substance use and helping to keep our kids safe. Each of these presenters brings their own background and connection to this important issue, and we look forward to hearing more from them in their presentations. First, we'll hear from Randy Abbott, a parent and recovery resource advocate with the Alcohol Drug Council of North Carolina, who will share his family's story. Then Jessica Dicken, the section chief of the Community Wellness, Prevention, and Health Integration Team at the North Carolina Department of Health and Human Services, Division of Mental Health, Developmental Disabilities, Substance Use Services, will provide an overview of youth substance use in North Carolina and will highlight the Department of Health and Human Services' many efforts in this space. Please note that our originally scheduled speaker from the North Carolina Department of Health and Human Services, Kelly Crosby, had a last-minute conflict arise. We are delighted that Jessica was able to step in for Kelly and join us today. Next, Jarmichael Harris with Addiction Professionals of North Carolina will share practical tips and resources to help us better support the young people in our lives. And finally, Attorney General Josh Stein will provide closing remarks about this important topic. Again, many thanks to all of our speakers and to each of you for being here today. So without further ado, Randy, please get us started.
Thank you, Sarah. So I want to introduce you all to my daughter. This is Vanessa, and you can see Vanessa here from that very first kinder photo. Just aged myself and my children. I don't know how long kinder photo's been gone, but that very first kinder photo to right next to it, a memorial charcoal drawing that was done by Teresa Clower of Into Light Project, which is based out of Asheville. A little bit about Vanessa. So Vanessa was the type of kid that loved everybody, everything, animal, person, it didn't matter. She was the type of person that if she saw someone collecting change on the street corner, she'd drive down to McDonald's, pick up lunch, bring it back, but she wouldn't just give them the lunch. She'd park her car, she'd get out, she'd sit down and have lunch with them and talk to them. She'd get to know the person. She truly believed that everyone deserved the life that they dreamed of, no matter what. Vanessa struggled at a very young age with mental health and later on through self-medication, substance use disorder. And on January the 31st of 2015, she lost her battle with substance use disorder at the age of 24 and died from an accidental overdose. I made a commitment at that time that I would get involved and begin to do work to hopefully keep any other parent from having to go through that. Next slide, please. So early on in my advocacy, I heard something. It's still so vivid in my mind. I remember I was sitting in McKimmon Center during an OPDAC meeting, and someone said something that literally made me just sit up and take notice. And I remember the feelings of anxiety and downright sadness when I heard it. And the statement was that the nation's addiction crisis is a pediatric issue. And I thought, I don't understand that. How can that be? So what they were speaking to were the results from a poll that was conducted at Columbia University. And what they found is that 90% of Americans who met the criteria for a substance use disorder had started experimenting with substances before the age of 18. Over 60% started experimenting while they were in middle school. And the most impactful part of this for me is that we know now that the longer we can delay that first use or first experimentation with substances, um, the higher the percentages are that someone will not have a substance use disorder. And you can see the numbers here. If you delay first use until after 21, you go from 1 in 4 Americans who have a substance use disorder who started before the age of 18 to 1 in 25. So those are pretty good odds. Next slide, please. So what are we supposed to do as parents? I'm actually currently at a conference. If you hear background noise, I apologize, but I'm currently at a conference and just came out of a session this morning with a number of sessions on, what we do and what resources are out there. So go to the next slide, if you would, please. So, don't run, call 911. Would you let your friend die? That's something that's very passionate to me. That happened with my daughter. The group she was with panicked. They did not dial 911 until it was too late. I have very good friends, Mary O'Donnell and Julie Cummins, who both lost their sons to alcohol and just basically they had been out partying. They were underage. Their friends left them, and both boys who were best friends passed away just weeks apart because the group they were with were scared to call 911. So we were talking about the numbers just 2 seconds ago on percentages and children starting to experiment with substances in middle school and high school. A very large percentage of those substances come from the home medicine cabinet, the home bar. But when you talk about the medicine cabinet, one great way to avoid that is drop boxes. You can go to this link for Operation Medicine Drop, and you can pull up a map of the hundreds and hundreds of medication drop boxes in our state. They're all over our state. And don't let your unused medications sit around. Don't let them be there. It's tempting sometimes to say, well, I didn't take all of this prescription. I'm going to hang on to it for when I need it later. There's no need to do that. So one way to do that is to lock your medications and get rid of unused medicines. Talk It Out. I just sat in a session this morning from Talk It Out, and the resources on the Talk It Out website about how to talk to your kids. It's not about sitting them down at the dinner table and having that talk about substances and underage drinking and the dangers. It's learning how to talk to your kids in bites. When you're driving in the car, when you're out for a walk, whatever. How to talk to your kids about substances and the dangers of addiction. So if we're going to keep our children safe, we have to start with those open and honest conversations. Naloxone saves. Naloxone, for those of you that may not know, is an opioid reversal medication. There's a number of ways that it can be administered. It is perfectly harmless if someone has not taken an opioid and they're overdosing. It's not going to hurt them. But if it is an opioid and they are overdosing and you administer naloxone, it can save their life. So teaching people to carry naloxone And yeah, it sounds scary and it sounds unnecessary to talk about having our high school kids carrying naloxone around with them. But if it can save a life, if it can save your high schooler or your college student, when you want to do it. If you're in a situation where your loved one is already in a crisis situation, or they're already suffering from an addiction or a substance use disorder or mental health disorder, the Alcohol Drug Council of North Carolina is a great resource. You can go to our website, and on that website, there is a resource directory. You can pull up resources from around the state. I'm happy to share in the chat our phone number as well. We also man a call center, and I'm one of the resource advocates. We've got a number of people that are there to answer the phone, to talk to you, and to help guide you into navigating the system to look for those resources around our state. And I'll put that phone number in the chat here in just a second. So this is me. This is how you can get in touch with me if you have any questions, or if something comes up later on that you'd like to hear more about. I feel like I've kind of rushed through this, but it's hard for me to do anything in a short time. So I hope I've given you some good information and some good thoughts. It's about protecting our future generation, like this says. And I want to say thank you to DHHS and to the DOJ for including me in this. And now Jessica Dickin is going to carry you through more of the resources. So please, if you ever have any questions of it, reach out.
Thank you, Randy. That was really great. As a parent, as a person who has a family member struggling with substance use, as a person who lost a close family member in 2017 to overdose, this is passionate for me. It's not just a job. So go ahead with the slides. So I want to tell you a little bit about the Department of Mental Health. We've been working very closely for the past 2 years on a strategic plan, excuse me. And you'll see that there's a lot of different values here that we're trying to make sure that all of you know about. I won't read all of these, but the thing that we're talking about today is preventing substance misuse and overdose. And we really want to consider equity, inclusivity, lived experience, quality, and making sure that we're trauma informed in all of our approaches. So the goals for the preventing substance misuse and overdose really relate to a lot of the things that Randy was talking about. Delaying initial substance exposure or use in children and adolescents. I completely agree that the longer that we can delay the use of young people, the better chance that they will have to be successful and healthy adults. We're also looking to raise public awareness on substance misuse, and as well as the accessibility of services and supports. We're looking to increase the number of individuals receiving evidence-based prevention and substance use disorder services. And as we're all well aware, we're also trying to reduce the deaths due to overdose. We're not in this alone. We have a lot of different partners across the state and within our system who do this work every day. And I'm going to be highlighting some of the information that we have and some of the services that we provide. So as you can imagine, there's definitely a need in North Carolina. Randy talked about this as well. For youth ages 12 to 17, we have about 41,000 people who have a substance use disorder, and about 15,000 young people who have an alcohol use disorder. Opioid overdose, if you've heard anything in our state and been around all of these great people, we've definitely had increases in overdoses, especially during the pandemic. I did look at some data recently, and I'm happy to see that some of this trajectory is hopefully slowly trending down. But in 2022, amongst youth, we did have 191 reported emergency department visits, and unfortunately 22 fatal opioid overdoses. And overall, 60% of these deaths did involve multiple substances. So looking at some data from Wake Forest, their youth and young adult survey, we surveyed 15,000 people across the state of North Carolina. As you can imagine, the largest, darkest brown piece of information here on the bar charts are from people who are from the ages of 21 and 25. There's a lot of risk associated with that age range. You can see that 36% of those young people are using alcohol, cigarette smoking, and vaping. You'll see that the other bars are representing younger people, the 18 to 20-year-olds, and then 15 to 17-year-olds, and 12 to 14-year-olds. So there's still work to be done. You can see that for those of you who are parents, for those of you who have youth and young people in your lives, maybe they're a member of your church, maybe they're a person that you go and do volunteer work, you see them in the communities, they're your next door neighbors. It's really important to know that youth and young people sometimes get these substances, you can see, from friends and from family members. And interestingly enough, for prescription medication, these are prescriptions that are found in your own homes. They're the own prescriptions. So it's very important that we consider prevention activities associated with these things. As you can see, we all want to be good stewards. We all want to be good parents. We all want to be good friends and good neighbors. But unfortunately, some of us don't really lock up our alcohol. We store it in our kitchen, our cabinets, sometimes our bar carts or wine, maybe in a garage fridge. And as you can see, 46% of us leave it unlocked. And sometimes we do it both unlocked and locked. Prescription medication use really is a lifetime issue across the lifespan as we move forward into middle age and older age. We have medications, perhaps. It's really important that we consider the young people in our lives and that we securely store our medication. As you can see with this bar chart, again, it's those 21 to 25-year-olds who really do have access and are misusing prescription medications. So what are we doing about it? So here at the division, there are so many things that we could highlight, and I have very little time, but some of the things that we work as part of the Prevention Block Grant, and we receive approximately $9 million a year. Now, I think that equals out to be about 60 cents per North Carolinian, so it's not as much as you'd think, but we do try to serve all 100 counties with our funding. We do things like educational programs. You see Too Good for Drugs here and HALO, the Healthy Alternatives for Young Ones. We work with parents. You'll see the Strong African American Families program. We also work in our communities. We are members of coalitions. We work on strategic planning groups. We plan take-back events like Randy was talking about across the state to take back your your prescription drugs. We encourage the locking of medications in schools, on trips, in the community. We encourage just really thinking about the access points that young people have to substances that they may misuse. We also work with our partners at the Department of Public Health on some of our reducing retail access to minors, and that's our SINAR program. We also have some secure storage campaigns. Hopefully some of you have seen our Lock Your Meds campaigns, encouraging you to really think about don't let anybody take your medication and lock up your medication. We also have the Don't Let Your House Become a liquor store messaging with our Talk It Up, Lock It Up campaign. And we also targeted some retailers in several different counties here, making sure that we ask our retailers to be responsible and checking ID if young people or anybody purchasing tobacco products look to be under 27 years old. We offer a free online retailer training. And by the way, our data is showing that there's 83% more chance that if retailers don't check for ID, they're 83% more likely to sell. There's a lot of other additional initiatives that we have across the board. One of the things is our state opioid response. We are in 9 counties in North Carolina with evidence-based prevention education curriculum. This is in addition to the $9 million that we have in our block grant. We're looking for young people who are perhaps in historically marginalized or underserved communities. And we're looking to make sure that if they've been identified at being at risk for opioid use disorder, that we're trying to get them education and information so that they can make good decisions moving forward. We also have our Partnerships for Success grant, which is in our no-cost extension year. You can see that we're serving 12 different counties across North Carolina. We're focusing on preventing alcohol, e-cigarettes, and marijuana. We're including things like DUI checkpoints, curriculums like Catch My Breath to hopefully to avoid e-cigarette use, Talk It Up, Lock It Up, Escape the Vape. And we're also distributing alcohol cabinet locks and bottle locks to hopefully encourage communities to securely store their alcohol. We have our Preventing Drug Overdose grant. This isn't a 5-year grant that we have. We're really happy to see that we have been training first responders and community members with making sure that they recognize the signs and symptoms of an overdose, that they're trained to respond, and that they're also providing naloxone as needed and take away doses as well, or leave behind doses. You'll see the numbers here. What I'm most proud of is that we have had only in the first about 8 months of our program, we've had 285 people referred to treatment, and 201 of those people were engaged in some sort of treatment services, which is a 70% engagement rate. You can see that we have many 84 opioid treatment programs across the state. As of January of 2023, 22% of those participants had Medicaid. I'm very hopeful that as of December, we'll have a lot more participants who have Medicaid due to Medicaid transformation. So how do you all get involved? Randy mentioned a lot of great resources. Here's a couple more resources from our department. There's approximately 60 coalitions listed here. If you see yourself and there's an area that you'd like to join with one of those blue dots, please click on the link, and I know that's going to be shared in the chat. If there's somewhere else that you don't see a dot, we are so helpful and looking forward and hoping we can help you start a coalition if you need. And then, of course, we've got our 988 line that launched in July of 2022. If you call 988 or 1-800-273-TALK, we are happy to give you a bunch of different resources and to hopefully have some information to prevent suicide. And of course, if you're in crisis, we encourage you to call us. There's our Peer Warm line that we just started very recently. You can speak to a person who is a peer support specialist who is living in recovery from mental health illness or substance use disorder. They offer a lot of different support and resources for anybody who reaches out. We encourage you to reach out to our Peer Warm line. And we have our side-by-side webinars. Our next side-by-side webinar is March 4th, and it'll be talking about child behavioral health. So we encourage you to join us. We would love to see over 500 of you join us as well. And with that, thank you so much for your time. Thank you to the DOJ for including us in your discussion. And I'm happy to turn it over to my colleague, Jermichael Harris from Addiction Professionals of North Carolina.
Thank you so much, Jessica, and thank you to the North Carolina DOJ and North Carolina DHHS for inviting AP&C to be a part of this important conversation. My name is Jay Harris, he, him pronouns, and I serve as the Director of Scholastic Recovery at the Addiction Professionals of North Carolina. This has been a really great conversation, but I think one of the things that I find in terms of kind of keeping track of what's happening and understanding the trends is the University of Michigan's Monitoring the Future survey. This survey, I'm sorry, excuse me. This survey reaches out to high school campuses across the nation, including both our public institutions and private schools. And since 1975, has been surveying 12th graders. And then starting in 1990, started adding both 8th graders and 10th graders annually to this research that they're doing. This past year, 2023, they had over 22,000 surveys returned back to the study, including 7 schools right here in North Carolina. I think one of the things that are most of note, and I think really exciting, is that the reported abstinence from alcohol to cannabis and nicotine is currently up and also trending upwards even before the pandemic challenges that we've had, right? As we know that the pandemic brought lots of mental health issues and challenges for our young people, and many of them turned to substances during that time period. And so to see that the reported number of abstinence is up is absolutely amazing to me. Also of note is that the use of illicit substances is trending downward. So obviously we're doing some things right in all of the scrambling that we've been doing in the last few years to really turn the tide and address some things. And so it's exciting to see that to be the case. Considering that Monitoring the Future shows alcohol, vaping, and cannabis to be some of the most reported substances amongst teens, I have a few items for us to chew on really quickly. Concerning alcohol and all substances, I think it's just really important to dispel the myths that everybody's doing it. Randy earlier talked about the Talk It Out campaign, Talk It Out NC. I think that's a really great series to utilize for age-appropriate conversations, starting to help start those conversations with our kids. And again, it's age appropriate. So there are some that are set out for, under 12, and then another period from like 13 to 15, and so on and so forth, up to 20 years old. And again, having those conversations in small bites, driving down the road while you're watching TV, I think is a great way to keep the conversation going and have your students thinking about how they perceive substances and, maybe what their friends are into. I think additionally, understanding that the Sober Curious movement has been really booming for the last 5 years and evolving to the point that many companies known for their alcohol beverages are now creating non-alcoholic options. And we're also starting to see sober bars popping up across our state. In terms of vaping, one of the things that we're starting to see is there is a reported downward trend of nicotine vaping, but I won't be fooled into thinking that that's not, that this whole idea of vaping is starting to end, because we certainly know that it's prevalent. In fact, in this last year's Monitoring the Future report, 28% of high school students report vaping daily, and another 20% report vaping cannabis products. And so understanding that when we talk about vaping, we oftentimes think about nicotine, but also recognizing that cannabis is also being sold in vaping formats as well. And I think the earlier that we having these conversations with our teens around vaping and the perceived risk about vaping, especially understanding that many of our teens and young people in general identify vaping as a healthier and safer alternative to other modes of use. We know that's just not the case. And so being able to provide our young people with real concrete conversation and information, I think really helps to kind of change that perspective. In terms of cannabis, Monitoring the Future says that 11% of 12th graders are using Delta 8. If you're familiar with cannabis or weed, there are many different types of cannabinoids that are associated with that, right? Those are the chemical compounds that extract different behaviors or different responses. And so when we think about cannabis or weed in particular, Delta 9 is what we consider THC that most of us think of. But because science will science, we've been able to extract various cannabinoids like Delta 8 and Delta 10 to provide similar effects as Delta 9, but might not always be detected in drug testing, right? And the challenge with that is, if you remember back just a few years ago with Spice and K2, we have these synthetic cannabinoids that are being created and oftentimes sprayed on top of CBD plants that then mimic the reactions of cannabis or of weed. And they can have negative side effects, including hallucinations, vomiting, anxiety, and loss of consciousness, to name just a few of the negative side effects that are related to the use of Delta 8 or Delta 10 cannabinoids. And also understanding that even if you are using Delta 9 THC, the normal THC, as you might think of, this is not the same flower from the 2000s, the 90s, or even the 80s and beyond. With the widespread legalization of THC, it's created a market for enhanced versions where these new age chemists are extracting up to 90% THC from the plant and putting it into vapes, gummies, and other products, and can have very similar results to the same negative side effects that we're talking about, hallucinations and even psychosis. So again, having these conversations with our students, letting them know that, yes, while we see these CBD shops popping up all over and they have these bright neon signs, and some of them are kind of taking this wellness approach that makes you think that it's safer, that it's more preferred, that it still runs some of the very similar side effects and consequences as things that might not be as reputed to be as well, right? And so just being mindful of my time as well, thinking about the various resources that we have across our state. I would be remiss if I did not take the time to acknowledge those who are doing the great work across our state to lead the way and change behavior, especially for our young people. North Carolina is currently home to 2 recovery high schools here, Emerald School of Excellence in Charlotte and the Wake Monarch Academy. These are 2 private schools that provide a specialized curriculum for students that have chosen a life of absence. It is my hope that we see more of these programs developed across the state. And then also recognizing that our state also has nearly 30 collegiate recovery programs and communities. These are campus-sponsored resources at almost every level, whether it be community colleges, our private institutions, as well as our public institutions, that provides resources to help students navigate their chosen recovery pathway and provide peer support and campus education of topics of mental health and substance use. And with that, I'll now introduce our Attorney General, Josh Stein. Again, I say thank you for having me. And Josh Stein, our Attorney General, serves as the 50th Attorney General here in our state. And while probably best known for his fight for the $50 billion in opioid settlement money, he also won a $40 million decision with e-cigarette maker Juul, making North Carolina the first state to successfully hold Juul accountable for its role in spiking teen use and dependence on e-cigarettes. Attorney General Stein has a proven track record for looking after North Carolinians and especially our youth. Please welcome Attorney General Josh Stein.
Thank you so much, Michael. I appreciate that kind introduction, and I really appreciate your comments, as well as Jessica and Randy's. Thank you very much. I appreciate everybody for taking the time to share their expertise, experience, and perspectives with us. This is the 3rd webinar in our series about protecting the next generation, and we want to have these conversations to give everyone who cares for kids the information and tools that they need to help young people successfully overcome challenges and get the support that they need. I have 3 kids, and I know how hard it is for them and their friends to navigate the onslaught of challenges that they face, especially because these challenges are in addition to the ones that we older people had when we were growing up. Kids are experiencing depression, anxiety, drug misuse, addiction, self-injury, and suicide at alarming rates. The U.S. Surgeon General has declared a youth mental health crisis. And while we wish there were a single easy solution, we know that it's more complicated than that. Today's conversation about youth substance misuse was one that we knew we had to cover because everywhere I travel in the state, I hear devastating stories about kids struggling with addiction to nicotine or other drugs. The challenge is kids' brains are still developing well into their 20s. And if young people get addicted to any substance, then their brains develop the neural pathways that can lead to more addiction to other substances later in life, which dramatically diminishes their future prospects. That's why here at the Department of Justice, we've made the health and safety of children a very high priority for us. In recent years, Juul, the e-cigarette company, as Jermichael was just talking about, sparked a teen vaping epidemic. The reality of Juul first smacked me upside my head when I was cleaning up our TV room after my then teenagers had some friends over. And I had to ask my boys about what were these pods I found. And it started a conversation about e-cigarettes that I subsequently found myself spending a great deal of time on. And I met with kids whose lives were turned completely upside down because of their nicotine addiction, failing grades, quitting sports, actually requiring medical treatment. And studies have shown that nicotine addiction increases anxiety and depression in our kids. And what was so venal is that Juul designed, marketed, and sold its product targeting young people, hooking them on nicotine, while the founders and original investors made billions of dollars. They developed kid-friendly dessert and fruit-flavored nicotine pods that were reformulated to be smoother for teenage throats who hadn't started smoking yet, smoother to inhale, and in concentrations that accelerated the chemical dependence. The device itself was sleek and looked like a USB drive, again, to attract kids. We were the first state to take Juul to court for hooking kids on nicotine, and we were the first state to hold them accountable, setting a standard that the rest of the nation has now followed. We forced Juul to change its marketing and sales product practices to protect young people, and we won $48 million to help kids conquer their addiction and prevent others from getting addicted to begin with. Juul is not the only example of corporate greed, sadly. Purdue Pharma, the owners, the Sackler family, other drug companies made billions and billions of dollars while millions of Americans became hooked on opioids. And I've sat with countless parents across North Carolina like Randy who have lost their children to this crisis. And folks, their hearts are broken. But there are people like Randy who don't want other parents to experience the same agony that they have. And so there are really wonderful, heroic parents out there trying to do education to keep this from happening to other people. It used to be that overdoses were more common in middle and older aged adults than young people, but that's no longer the case. Opioid overdoses nearly doubled among 14 to 19-year-olds in a single year. From 2019 to 2020, the number of overdose deaths almost doubled. And then the next year, 20 to 21, it increased another 20%. People between 18 and 25 now have the highest rate of illicit prescription pill use. Addiction is clearly messing with our young people's heads. I was proud to help lead the National Bipartisan Coalition of State Attorneys General to take to court the big opioid drug companies that created and fueled the crisis that is killing our kids, first with pain pills, then with heroin, and now with fentanyl. We have been winning these cases. We've won more than $55 billion for the country. North Carolina's share is $1.5 billion. And nearly every dollar will go to help people who are struggling with addiction enjoy a healthier and happier future. You've heard about some of the solutions that these funds will go towards from Randy, Jessica, and Jermichael, but there are others like in Beaufort County, an opioid educator who works with young people to help delay the age of the first use, because the longer you can delay the first use, the less likely a person is to become addicted. A community health worker and substance misuse coordinator who have training in evidence-based youth opioid and substance misuse programs and can offer that education to folks in Iredell County. In McDowell County, there are educators with Hispanic community organization to help educate parents, teachers, coaches, and others who work with young people about how to support youth in what they're going through. These solutions and others that our funds help get off the ground will reduce demand for opioids by addressing addiction. But we also need to reduce the supply of fentanyl. So I've asked the General Assembly to fund a fentanyl control unit in my office to work with local prosecutors to investigate and break up drug trafficking rings. We also drafted and championed Senator Tom McGinnis's bill, the Stop Counterfeit Pill Act, which makes it a felony to possess equipment knowing or intending that it will be used to manufacture a controlled substance. And that bill became law last May. We've also convened a statewide fentanyl law enforcement task force, which brings together local, state, and federal law enforcement leaders around the table so that we can identify ways to help each other identify and then hold accountable drug traffickers. Our young people are facing incredible challenges, addiction being one of them. But as parents and as a state, there's nothing more important than keeping our children safe and giving them the best chance to succeed and thrive. By doing that, in that process, we will build a safer and stronger North Carolina. I want to thank again the panelists for sharing their expertise with us this lunch hour. And I want to thank everyone who has joined this webinar to learn. I mean, the fact that you're taking your lunch hour is proof about your care for the next generation, which is exactly what this webinar series is all about, is to protect the next generation. And I'll hand it off to Sarah to close us out. Sarah?
Thank you. And thank you everyone for joining us today. We certainly hope this session was informative. Many thanks to all of our presenters and to our co-hosts today. Here we have listed some of the many resources provided by our presenters that we hope will be of use to you and your families. We will be sharing a recording of this webinar and will in an email send a copy of the presentation slides, links to all resources mentioned, and respond to all questions not covered. Please look for that email to come soon. Again, this was the third in our series, Protecting the Next Generation of North Carolinians. Our website will be updated with any future topics and dates. Please visit ncdoj.gov/nextgen-webinar and share this link with family, friends, and colleagues you think may be interested in this series. Thank you for your interest in learning more about youth substance use and keeping our next generation safe.